pharmacy automation?
There's a lot of promises in pharmacy automation for reducing the cost. I think one of the things that's really interesting about our systems when you put them in and other pharmacy automation vendors who are like us is that all of a sudden you can begin to track all of the drug spend for your hospital, and you can know whether or not you're actually ordering the right things for the patient, whether or not what your doctors are prescribing is what you have in the pharmacy, whether or not you're keeping too much of one thing, not enough of another, having to pay a lot of stat charges for things that you didn't think you needed. And I think you can get really smart about where your dollars are going. A lot of medication, unfortunately, gets ordered, sits on the shelf until it expires, and then has to be disposed of. I think that other interesting things about pharmacy automation is just-in-time delivery of medication to patients. And in some of the traditional environments where we've taken pharmacy automation, people get a 30-day pack of medication, and their medication may change in 2 or 3 days, and then the rest of that medication just has to be destroyed. Whereas pharmacy automation can allow you to dispense medication to the patient just before the patients need the drugs, and that dramatically reduces the carrying cost and the inventory cost of drugs. Now, the drug wholesalers don't necessarily like to hear that, but there is a tremendous amount of waste in the system, and the waste generates a lot of cost, not just for the particular homes or the insurance plans, but also for the government, who has to track that waste in certain classes of drugs to make sure it's not actually being diverted, which is what we call theft in the healthcare industry.